The following is brought to you by VerticalVet. Rethink your GPO.
Hello everyone, and welcome to another exciting panel discussion from your friends at VerticalVet. I am Dr. Ernie Ward, Chief Veterinary Officer, and it is my utmost pleasure to bring you to another really interesting discussion that we deal with in the daily. And today we're going to talk about what do you do when one of your team members does something that you don't agree with. And this can be subtle things like catheter placement, needle size choices, whatever, all the way up to more contentious things like declawing, debarking, tail docking, all that stuff that some people disagree with. So today, I am so glad to be joined by two of our VerticalVet alumni, superkins, wonderful assets for our team and people you should get to know. First of all, we have Megan Sturgill, who is an RVT for over 20 years. She has managed large animal, small animal clinics, you name it, she's done it. And of course, now she serves as our Vice President of Operations. And if you don't know Megan Sturgill, you need to get to know her if you're a VerticalVet member, because if you have a problem, she solves it. We're also joined by one of our newer members, Katee Spence. She is an MBA along with a Certified Veterinary Practice Management degree, and she is our Director and head of the programs for our Virtual Practice Manager program. And again, Katee is really taking things in an exciting direction for VerticalVet. So if your clinic doesn't have the resources or staffing or just needs some help managing your clinic, please reach out to us at VerticalVet because we can help you virtually manage your practice. So I'm so excited to have this conversation with you guys today. Thank you so much.
Looking forward to this conversation, Ernie. This is going to be awesome.
It really is. And you know, Katee, this is one of those dilemmas that it happens on the daily and we just don't talk about it enough. So before we get started today, just before we even get into our bullet points and what we want to talk about, Katee, just set up the dilemma that we're talking about.
So the dilemma is that something would occur in the practice that you may disagree with. Like you said, it can be as simple as the way a catheter was placed or the way that it was taped in maybe. And it kind of bugs you and irks you. Or even up to, like you said, declawing and tail docking and some of those things that some people have pretty strong opinions about. So what we're going to talk to you about today is how to deal with that, how to approach your staff or your associates, and what kind of environment to set up to be successful in this, where people can have multiple opinions, because there's more than one way to get from point A to point B. And just because someone does it differently than you doesn't mean that it is wrong necessarily.
Okay, I love that. Now, Megan, we've heard the MBA CVPM perspective on this topic, but now let's get back to the dirty trenches side that you and I reside in. So tell us what you want to talk about today as far as, if somebody's doing something that you don't necessarily agree with or like, or maybe you'd like to change it.
Oh yeah, absolutely. So Ernie, a couple things that I want to bring up, and those of my friends who are watching this or people that I've had the privilege of working with in the past, I think that we all can say that there is a fear, or there is kind of this expectation that as you spend a lot of time within this career, within vet med, within practice medicine, that you can be stuck in your ways. And so things simple, right? We keep going back to the catheter placement. We keep going back to what size needle you should use for that stick. Things like that can have the potential of creating some discourse or some uncomfortable feelings between team members, because we have a technician or we have a staff member that's stuck in their way of doing something. And so how can we look at these opportunities of kind of what Katee said, two ways of doing something, to look at the efficiency and to be able to come up with a plan that makes the most sense for our practices, and also understanding that everyone does something differently, and that can positively affect the culture of your practice.
Yeah, and I'm glad both of you touched on the two really foundations that I want to discuss today, and that is it can create friction and tension and disharmony within a team, because, it doesn't mean necessarily that you're doing something wrong, but you're doing it in a different fashion. And look, in these day and age when people are changing jobs more frequently than ever in my 30 years in the profession, you may be bringing a new doctor, a new veterinary technician, a new whomever in, and they've got a different way of doing things. And again, we've got to learn learn how to work together. Now, I will say at the outset, you've heard me say this multiple times, both in my lectures and writings, and certainly here at Vertical Vet, you've got to have, some basic guidelines. I call them guardrails. It just sort of keeps people in a lane from crashing off into the ravine. And so today we want to talk about not only how you can create some consistency, but also how you can work together and be a little more flexible, I guess, when it comes to this. So the first thing is around efficiency. And so I want to get both of your perspectives on this. When we look at the importance of SOPs or standard operating procedures, these are our guardrails, our guidelines. So Megan, I'd like to start off with you today. Explain what you mean when you talk about, hey, we want to really, look at being flexible, but also having some guardrails or guidelines.
Yeah, absolutely. Great question. So, a couple things that when we think about standard operating procedures in this conversation, I want you guys to think about the broader picture. So, as a practice, you're developing your vaccine protocol or maybe your wellness protocols. And those are your guidelines as a practice. So, those are going to be designed by your practice owner, your practice manager, your hospital administration to kind of help create those guide rails or those guardrails for your practice. But within those guardrails, you can have some different ways of doing things. Maybe it comes to looking at being able to have a technician that says, well, really want to focus on diets. I really want to focus on having those conversations in the exam room with the client, where you might have another technician that doesn't want to do those things, that doesn't feel comfortable having those conversations. And this is just a very broad example, but that's two very different ways of handling a wellness exam when you're looking at the guardrails that is kind of your procedures, your policies, your protocols. And so in those situations, that's when you kind of look at the efficiency of how can what I'm saying as a practice affect the efficiency in those rooms.
Okay, so Katee, part of this first bullet point that we want to discuss with the membership today is the not agreeing with aspect, right? I mean, that's the whole title of it. So getting back to vaccines, for example, I think that's a great starting point. So Katee, what bits of advice do you have for that person who's saying, I just don't agree. This clinic is asking me to do annual vaccinations where I believe in triennial or every 3-year vaccine protocols. How do we get along? How do we work that out?
I think that you need to create an environment that you have collaboration and opinions. So what I would suggest is, as the associates of the practice and the doctors that work together, that they sit down and they talk about their vaccine protocol. So if somebody comes in that's new to the practice and disagrees with the way that it's going, and they would, recommend something different, why is that? Let's take what they're saying into consideration and discuss what is best for this practice, what's best medicine, what's going to be more efficient, what's going to be better for the animal, all of those different factors that go into it, and how are we going to do this. I feel like vaccines is one thing that you do need to be pretty standardized on, because from the front staff all the way to when the patient's in the room with the doctor, that they call and say, I got this 6-week-old puppy, what's the protocol, or what do I need to do to get them started? The front needs to be able to explain that to them, and they can't say, well, Dr. A is going to do this and Dr. B is going to do this, so I don't know which one that you want to do. It needs to be the same. And so that's one thing that does need to be standardized, but it needs to be an open conversation between the doctors of, what do we want to do here? And then the owner is the ultimate decision maker. What's the mission and vision of this practice, and why are we doing what we're doing, and how can we stand behind that and everybody get on the same page? And that does come with some compromise, of course.
Exactly. And you can see now why back in the day I used the term guardrail, because I'm assuming we're on the same road, right? And that's really where this begins, because there are certain things, Vertical Vet membership, I will tell you, there are certain things that you just can't bend and compromise on, right? So maybe you have a staunch opinion against declawing, for example. Well, if the clinic believes in it, that may not be a good fit. So I don't want to go that way today, guys, because I think it's pretty obvious. But what bothers me the most, Megan, is when we look at these things, most of the time I find when there's friction in the team, between like catheter placement, oh, I only use a 21, oh, I only use a 22, oh, I only use a 18, or I tape it this way, not that way, right? I mean, those simple things, that's what really disrupts the team. So let's kind of get back to that element, if you will. So explain to me, and to everyone, again, why you believe, as I do, and Katee does as well, and everybody here at Vertical Vet, why you've got to actually invest the time and make these SOPs, because this is that whole foundation. This is the communication, the transparency. So maybe for that person out there who's going, okay, I got some of this, but do I really have to do more? Explain to them what you think.
Yeah, absolutely. So SOPs are really important. It gives you a foundation for your practice. And so when we're looking at practices, and I think Katee can attest to this as well, when you're looking at practices that are struggling a little bit with some of these kind of turmoils that are happening, or this contention that's happening between staff members, sometimes it can be because the policies, the SOPs that are in place aren't clearly outlined. And so when you have an SOP, when you have a clear foundation for your team members to follow, it allows them structure in their day. And so within those SOPs, you have to look at, what am I, as a practice manager, as a practice owner, or a leader within my organization, what am I going to allow flexibility in? So if the SOP is, we're going to use this standard procedure for our puppy vaccines, this is what it is. But are you going to allow any flexibility in that? Well, I mean, depending on the patient, maybe, there's going to be one vaccine that's not going to be included in that puppy visit. But again, that has to be discussed with the practice owner in order to have that be kind of one of those areas that they have a say in. So when we're looking at SOPs, again, we want to make sure we're looking at, where am I going to offer flexibility, or am I not? And there's no right answer to that. That's kind of the decisions that the practice owner, the practice manager, the leadership needs to make. Then it's really looking at your team and saying, what are the things that we're finding there's a couple different ways of doing something, and how can we look at this a little bit further to see, is it okay that we're going to allow 3 different ways to do this one procedure, or as a practice, do we want to standardize and say, this is the way that we're going to move forward?
Yeah, I love this. And again, what we're trying to say is you do need to have some collaboration and agreement on the big things, right? So vaccines and surgical procedures and all that stuff. But I will tell you right now, the stuff that causes people, drives them crazy, it's the simple things, okay? So let's talk about the simple things, Katee. Let's start with you. Okay. It's for me, as a practice owner, it boils down to efficiency. And I think, we talk about that. We throw that word around a lot, but how does that play into this not agreeing with how somebody's doing something, right? I mean, at the end of the day, to me, it's like, it's results driven. So maybe explain what your opinion is on efficiency and how that plays in with which we do or don't, and what do we allow and how flexible and so forth.
Yeah, so I mean, I think that you can look at different ways that somebody's doing something and determine what's more efficient and what works better for the practice. And maybe it comes down to costs associated with that as well. If they're using, more items, like, do you use a T-port for everything or not? That sort of thing. And what's the cost of that? Does that affect what we're charging for it? And as far as efficiency goes, I mean, not just because you use a different size needle or catheter doesn't necessarily make it less efficient. Does it take the same amount of time to put that needle on that syringe? Probably so. So do you really want to harp in on that and really, make people do things exactly one way? Maybe not. Maybe that's the thing that you let go and have some more flexibility in, so you don't have people being contentious with each other over something kind of silly. But then the bigger items, like, we keep going back to, like, vaccine protocol and things like that, those are going to be things. Or when, how often do you require that they come in for exams, for their heartworm prevention, for the heartworm test? All of those types of standard procedures are things that, you might be less flexible on. And then thinking about, how that makes the practice more efficient, because they know what the answer is when somebody asks them the question, especially at the front or the technical staff, and they don't have to go and ask someone else or say, oh, well, I don't know, sometimes we do it this way and sometimes we do it that way. That's where you're going to see some really big inefficiencies, is taking the time to decide every single time the question is asked versus laying these guidelines out, and this is how we're going to do this. And so they know each time, and then they get into a routine. I think that's important too, is that there's a routine associated with it that makes it more efficient, that they don't have to really think about, oh, well, am I going to do it this way or am I going to do it that way?
Right. And again, so Megan, as an RVT, you and I would agree, like, okay, the efficiency thing, if you're just as fast with whatever it is, we're fine. But you and I are more concerned about the risks we're worried about the medical outcomes. So maybe explain a little bit about how that factors into this discussion about agreeing with how someone is doing something, right? I mean, at the end of the day, if it's harmful to our patients in any way, I mean, it's got to be tossed out. And so how do you go about, one, deciding if it's posing additional risk to the patient, and then how do you change it if you think it is?
Absolutely. I think the first thing that we need to think about, and I've come on this platform before and I've talked about open communication, but if you're working with another team member and they're your peer, right? So technician to technician, and you're struggling with the way that your fellow technician is doing something, you really need to ask yourself three different questions. One is this efficient way of doing something? Can I learn from it? Is this something that is creating more use of a product or having a negative effect on the practice one way or another? And then third is, what's my patient's outcome? Is this going to affect my patient in any way, shape, or form? And if you are answering or asking yourself those questions and coming up with the answer, it's really going to help you decide how you're going to move forward. Now, if there is a risk to a patient in any stretch, I highly recommend that you go directly to, your practice owner, to your practice manager, and say, hey, I have these concerns. I need your support, and how do I address it? I think we need to go back and look at our conversations and team members as adult to adult conversations, right? There's not a parent-child situation happening in your practices. We're all adults. So how do we set ourselves up to have that conversation where you can go to your peer and say, listen, I'm a little concerned. I think, this patient is under anesthesia for a little too long because you're doing your post-surgical things a little bit differently than the rest of us are doing. And having a patient under anesthesia a little bit long, poses a risk.
Yep. Again, guardrails. This is so, and I believe this is the responsibility of the ownership of the doctor team, right? So again, no matter what position you're in, whether it's receptionist, assistant, tech, or doctor, if you see something that you feel uncomfortable with, that maybe it's posing a risk or somehow it just doesn't feel right, you owe it to that patient, to all your patients, to bring that forward. And again, this is just getting right back to where we started, guys. It's setting out these SOPs, sitting down, creating these guardrails. You've got to enforce them. There's flexibility on the road, but at the end of the day, from a patient outcome and risk assessment, Megan, that is squarely in our camp. That's our responsibility as medical professionals. Well, I do want to kind of, get your opinion, Katee, on something, and that is, when should you step in as a leader, right? Because I think a lot of times we are witnessing what's happening in the treatment area. And we go, that just doesn't seem super efficient, or, it seems like two different ways of doing something. At what point does it rise to the level of you, the practice manager or a practice team leader, step in and say, whoa, guys, we got to change things up?
Yeah, I think that you're really, when you get to a point of the patient being affected. So let's take the example of a patient comes in for a tech appointment for a nail trim, and they are very unhappy and stressed out and anxious. And, we got three people trying to accomplish this nail trim and, restrain this animal so we can get this done. Maybe that's time to take a step back. Is this really what we want to do? Maybe this patient needs to go home, with some medicine and come back when they're a little bit less worked up, and this would be a lot better for everyone. We're not going to harm the patient. So that's a situation where, you would step in immediately. I think when it comes down to, at the end of the day, we're going to get to the same outcome. We're going to have that catheter placed or what have you. Maybe it's taped in a little bit differently. That's something that you talk about after the fact of, okay, well, what is more efficient? What's the best way for us to do this? Are we going to leave this open for flexibility, or do we want to come up with a standard for that and write out an SOP or edit the one that we have? Is it time to make a change? Has something progressed to a point where we want to do it differently than we've done it forever? We don't want to be stuck in our ways. And so with that, I think that's where you have to gauge when you actually step in at that point in time, is when it gets to a certain point of escalation with the patient that you have any risk. That's when you right then. Otherwise, I think it's something that you kind of really want to think about and make an informed decision.
Okay, so, and I love that, I agree 100%, but let's now get back to the treatment area, Megan. You and I are back there, and you are the head tech of one of my clinics, and somebody just keeps putting a catheter in a way you don't like. They trim the nails just some way you don't like, right? Again, getting back to the whole content today, not agreeing. How do you, as the tech team leader, address that, right? When do you set aside your own personal sort of preferences? And I mean, you know what I'm getting at, because I know there are a lot of situations where that tech team leader just says, you know what, that's not how we do things around here. So help me out.
Oh, yes, absolutely, Ernie. So I'm laughing because I feel like there's been times in my career where I've been I've been the lady that's like, now we're doing it this way. And I think that in retrospect and looking back at those moments that I have personally had, I think that there was an opportunity there for me to ask a question, right? And so to that team member that's doing something differently than I am, I need to ask why. I can't assume that my way is the only way or the best way, or the absolute set in stone, this is the way that we're doing things. So asking that question, why are you placing that catheter like that? Why are you, restraining an animal like that? Or, what is the reason that you're doing what you're doing, and for what reason? And when you're getting the answer, that's going to give you a lot of information. Maybe that's just the way that they were taught, or maybe that there's a reason. Oh, well, when I do it this way, I realize that my patients seem to be a little bit more calm. Well, if that's the case, then I need to look at what I'm doing and kind of ask myself the same questions. Is what I'm doing, is it efficient? Is it causing additional stress? Is it the easy way of doing something? Asking myself those questions so that I can come up with, a good solid plan forward. Again, when we're in these situations, we need to understand that 6 plus 3 equals 9, and so does 5 plus 4, right? I mean, both those situations equal 9. It's just a matter of looking at some of these other factors. And at the end of the day, there's going to be a few things that you just need to recognize as a technician, as a tech leader, even putting this up into the front staff, that it's okay that there's multiple ways of doing things. It's okay. Now, in some situations when we're looking at the answer being, well, that's the way that I was taught. Is there an opportunity there for a lesson, for some sort of education there? Is there an opportunity to show your peer the reason why you're doing something, and an opportunity to, again, enhance the education level of your team member, right?
Yeah, I got to tell you, everything you just said there, rewind the tape, folks, and just go listen to it. And I'll tell you, I want to end today's conversation with you guys about, we said this in a variety of ways today, but it's being stuck in the old ways, right? And I think the biggest challenge to progress is just being comfortable in whatever it is you're doing. And so I know that on a personal level, I constantly try to challenge myself. Is what I'm doing the right way? I mean, Katee and Megan, you both have said things change, right? I mean, science evolves. And I think that's one of the things that really drives me crazy about my medical colleagues, because it's like, hey guys, the way we did things 20, 30 years ago may not be really scientifically valid today. So Katee, I want to start with you, and then Megan, I want to get your answer as well. How do we get out of our old habits? How do we get unstuck? Because, I think, me personally, you've got to have sort of a formal system in place to force yourself to rethink things. But I'd like to start off with you, Katee. Is, again, how does this hamper progress and growth, and how do we snap out of it?
Yeah, so I mean, being stuck in your ways, I mean, it can really hamper your growth, like you said, in your progress. It can negatively affect the bottom line, and the efficiency of your practice from, an inventory standpoint, and how you're doing things and what you're charging for them and that sort of thing. Especially if you're in a practice that, hasn't increased prices in years, which I've, come across that all the time. But the other thing to think about is, how do you approach this with your staff? So, from my perspective, and what I've done in the past is, first of all, I like to put some quantitative value to things. And how can I look at this from an analytical standpoint of benefiting the practice, especially when I'm talking to the practice owner and making changes? But I think when you're talking about medical changes and why you're doing things, is what's the science behind that? One of the things I love about veterinary medicine is that there's always continuing education happening. Most of us are required to do some for whatever our licensure is, whether it's CVPM, RVT, for a veterinarian, of course. But that is the thing that, keeps you going, is think about things that you are actually interested in. Don't just do the CE because you have to get the hours, but continually engage yourself in the industry, and in veterinary medicine, and what's progressing and what's new, and what's the new best practices that come out, because that happens all the time. And like I said, for me personally, it's really what drives me in this industry is that I'm continually learning. There's always something new to learn about, new ways to do things. How can we do this better? In not being stuck in, okay, well, this is just how we do it. That's how we've done it for 20 years. So we're not going to change that. Because when you get stuck in that mindset, then you get behind. And before you know it, you are 10, 15 years behind the times.
Yeah, and I love that. And again, Megan, it's not necessarily that it's right or wrong. It doesn't even mean that you'll have to change, but I think that you've got to reflect and say, why am I doing this, right? So you were using the example of maybe I was that person in my clinic who said, this is how we do it. I think if you can pause before you say, this is how we do it, and say, why do I believe this is how we should do it? So maybe explain a little bit about how you use understanding and discussing the why behind our protocols, our guardrails with our team members, and how does that impact, you agreeing or not, you being flexible or not. I mean, you see where I'm going with this. I mean, it's so important to understand the rationale behind the action, not just we do it this way.
Yeah, absolutely. I think I read a stat the other day that said every 60 days, something in vet med changes or becomes obsolete. Like, let that sink in for a second. Every 60 days, something changes. And so I think when we're looking at our practices, when we're looking at the ways of doing things, we need to say, when did I start doing it this way? And is there a new option that's come out since I started doing this that's going to be a little bit more effective in the way that I'm doing something within my practice? And that can be difficult, right? I feel like part one of the fun things about vet med is it becomes a part of our existence of who we are. We become a piece of vet med, if you will. And so it's really hard to look and say, oh, I need to do something different, but I've done it all these years. But the only way that we're going to progress within our profession, within our careers, within how our practice is performing is by staying at the forefront of that change, that forefront of that education. And like Katee said, I mean, some of the CE that you can, have access to can inspire change, can inspire you to think of the way that you're doing things as, okay, well, that was okay then, but now moving forward, this is okay. And really making sure that the whole team feels comfortable to have those types of conversations and retrospective thoughts upon their career and how they're doing something. I brought up culture a couple times in this call. I don't think that what we're saying here is to say we're going to create robots in our practices where they're all doing the same thing all the time, because then we kind of lose the flair that is the culture of your practice, that is this this practice that has some individuality within it. And so I don't want to have robots created, but rather being able to have these conversations where you're asking your team, why are you doing it that way? Were you taught that? Is there something behind the reason why? And is that something that I need to adapt in my skill set and my hard skills that I'm doing at the practice?
Yeah, and I'll leave you guys, my observation in 30 years as a veterinarian has been that people that are really resistant to change typically have very fragile egos, right? Because they feel that if they change something that they've been judged, well, you were wrong, right? And that's not it at all. It's not right or wrong. It's just evolving. It's progress. And so I would encourage you today that if you're listening to this conversation, you're going, maybe, maybe not, just really sit back and ask, well, why do you hold on to certain things? And what's the risk in questioning, right? I mean, for me, I've always found increased efficiency simply by saying, can we do it better? Why are we doing it this way anyway? And it was simple little things, in my clinics. I mean, I used to famously talk about, how we would where we would put the vaccines in our refrigerators, right? Just to improve efficiency, because we discovered, wow, unless there was a system for putting those trays in the refrigerator, you were hunting, right? So simple things like that, constantly asking. And again, don't fear, you're not being judged if you change, right? If you suddenly go from once a year annual vaccines to every 3 years for the core, that doesn't mean you were wrong. It doesn't mean you were not smart. It just means things have changed. And Megan, I appreciate what you said. Again, we know that our medical knowledge becomes obsolete so quickly. And again, that doesn't mean everything. I think sometimes people hide behind that, but it doesn't mean everything changes, but it does merit questioning. So again, Megan, as we sort of finish up today, and then Katee, I want to get to you. Any last bits of thoughts that you'd like to share with the Vertical Vet members today about, hey, somebody, I just don't agree with that.
Yeah, absolutely. I think that when we're looking at our teams, when you're looking at the peers that you're working with, your colleagues within your practice, I think that at the end of the day, you guys are all trying to do the same thing, right? And that is to better the lives of our patients and the clients who own them, right? That's the end of the day. And so if we're keeping that at the forefront of our thought, some of these, causing some sort of tension between the staff, you're doing it one way, I'm doing it another, don't do it that way. If at the end of the day we're saying, okay, we're trying to better the lives of our patients, then let's look at what's causing this little bit of turmoil between us and say, let's have a conversation. Let's say, why are you doing it that way? This is why I'm doing it that way. And we can say, okay, well, we're okay with us doing it, two separate ways. Or is there, somebody that can adapt in that situation? Being able to have those types of conversations and entering those conversations with your team members, that peer-to-peer level, right? That colleague to colleague, and not I'm better than, or you're wrong, I'm right. That's just going to create more turmoil in the long run.
Wow, love it. Katee, any last thoughts to share with the Vertical Vet members?
Yeah, so I can't agree with Megan more on the fact that, having these conversations with each other and being able to be open. One of the things that I enjoy the most about hiring someone that has experience and comes from, multiple clinics that they've worked at, maybe in another state, or, even if it's a doctor, a receptionist, a technical staff member, an assistant, a kennel worker, even, is, they always come in with new and different ideas of how they've seen it done elsewhere. And how can we, learn from that? Is there a better way that we could do this? Well, I've seen it done this way and it's really worked for me. And this is why. Take that into consideration. And those are those same conversations of, learning and evolving and trying to do things differently, if that's what needs to happen. Does it mean that every suggestion that comes along is going to be a fit and is going to be something that you're going to change? No, not necessarily. But be open to those conversations and be able to talk to each other about it. Because, like Megan said, maybe it'll be something that you'll have an aha moment like, huh, that is a really good idea. I've never thought of it that way.
Gosh, I think that we've had a lot of those moments today. I can't thank you guys
Yeah.
enough. Again, our two very amazing Vertical Vet team members here, Katee Spence and Megan Sturgill. Thank you so much for sharing your expertise with us today. I mean, this is why we love bringing you these panel discussions, because I get to talk to people like this and you get to learn from them. So thank you guys so very, very much. Well, guys, that is it for another one of Vertical Vet's panel discussions. Again, I want to thank my two colleagues from Vertical Vet, Megan Sturgill, an amazing RVT, and of course, one of our new members, Katee Spence, MBA CVPM. Again, at Vertical Vet, we are here with one singular goal, and that is to help you elevate your practice. And so if you're struggling with inventory management, or you want the best deals on whatever products that you need to use, if you need management advice, maybe you even need help with a practice manager, we have got you covered. And again, we have a vast team comprised of industry, professionals and a lot of experience. I think we've got now 5 RVTs. We got me as a vet. I mean, we got just amazing resources. So don't hesitate to lean on us. Again, we are so thankful for your time and attention. And if there's anything we can do to help you grow your clinic at Vertical Vet, don't hesitate to reach out. We will talk to you soon. I'm Dr. Ernie Ward. Bye.